We move to Dr. Lars Lindsköld, the President of the European Federation of Medical Informatics and board member of the Swedish Association for Medical Informatics. Lars and I have worked together for years, and we are very fortunate to have Lars join us online. Lars, over to you.
Thank you very much, and thank you to all previous speakers of sharing so much insights on this topic of digital health sans borders. I really enjoyed listening and understanding. Unfortunately, I couldn't join you in Geneva today. I'm in Glasgow, heading up the Medical Informatics conference in 2025. I was thinking about the approach here, and one thing I have learned during my years is that we often think and works in the vertical, in our own silo, in our own country, in our own organization, in our own office, and so on. And then suddenly this new things comes up to attention, the things we call digital. And the digital seems to move in the horizontal. And this is really bothering us all because we don't know how to look at it and understand it. We don't know which rules it lives on, what laws we should consider, and so on. So we see, for example, with this approach here, the benefits we could actually find from doing this globally. And I think it was Dino that talks about the standards, the way we agree on doing things, and previous speakers have talked about in healthcare, the type of standards we are using, and so on. And I think this could be achieved rather easily. The other thing is that if it's easy to do, it can be done for other purposes. And I would like to mention the new guy on the playground, the one we call AI. And it's, as you know, what it stands for, artificial intelligence. And if you think about that word semantically, it's rather strange that we should believe in something that is not real. Me, as from healthcare, I was thinking for a long time about AI, some additional information, because then we could understand how we should work with that additional information in our vertical. For around 1 year ago, when we saw the improvement of the large language models, and they introduced what they call deep research and so on, I started to realize that AI can stand for augmented information. And we started to see that in some countries where we had opened up for patients to have their access to their data, they use their own data to ask questions to the artificial friend that gave him suggestions on what to do. So the augmented also plays a role for us that works in the healthcare system, that it might give us possibilities to see and know more. And this is really difficult from as you said, the sovereignty, the integrity, and all these questions also. How much are we willing to share, and so on. But to round up this story is that the last 3 months I have been thinking that AI might stand for augmented influencers. That means that probably it can be that we will have forces around us that try to put us in a different way. So the problem I see is, who will be the influencer in the future? Will it be the researchers? Will it be organizations? Or will it be strong platforms and companies? So, as always with good values and benefits, it comes things that we should be concerned about also. So thank you again, Rajendra, that I had the opportunity to share my thoughts together with you and the things you have shared with me. Thank you very much.
Thank you so much, Lars.